Hi, everyone. So thank you, Tyler, for that session. And sorry about the break there. I think that just getting a couple of tech issues in order and making sure that we have our panelists all here, who I believe we do. So really excited for the next two sessions. They will link together and they will follow the very common and important theme, particularly looking at what leaders in workplaces can be doing, as well as a connection to how workplaces can be supporting the health of parents at work and families at work as well. So to introduce my next panel, I have got Emma Walsh and Andrea Christie-David with me today. So I might bring in Emma first of all, who is the parental leave gender equity expert and founder of Parents at Work, Australia's first dedicated return to work service for parents, and an organisation that we do work closely with. Hello, Emma. How are you?
Hi, Angela. Great to be here. Thanks for
And I've
having
also got Andrea Christie-David. Hello, Andrea.
Hi, Angela. Hi, Emma.
So Andrea is the founder and managing director of Leor, a service that delivers high quality early childhood education and disability support in the family home. So both are absolute experts on this conversation that we're about to have, and great advocates as well for some of the issues that we are covering. So as we know, as we've really gone through this morning, we know that employers have probably more power than they often think or know when it comes to the health and well-being of new parents. And that's from the experience women have when announcing that they're pregnant, and the experience that men have also when announcing that they're expecting, to having adequate and gender equal parental leave. And of course, supporting new parents in transitioning back to work, and then working flexibly, and then working with school-age children, and it continues and continues. So this is such a huge area. And all three of us, I know, are parents of young school-age children. And obviously this past year has been quite difficult for parents, and depending on their situation, the age of their kids, the ability of their kids to learn from home, the resources that they have access to. And what I think we all know is that parents are exhausted, and we also know that women have taken on the bulk of this additional work, in some cases putting their careers and even their well-beings on hold. So I want to start with a bit of a very big question. So to ask you both what you've observed here in November 2021, following what we really hope has been the end of lockdowns. Overall, do you see this as a year or a period of progress for the health of parents at work, and what more we can expect in the future, or has it set us back? Emma, I might go to you first.
Oh, yeah, what a great question. Well, I think probably both. I think, the first of all, the gain has been, I think, the visibility of caring in our community. I don't think that we really truly understood the value of the care economy before COVID. And it's not just about parenting and parents and the work that they do, but of course, doctors and nurses and everyone we've seen, really rally to be here and providing care to our community in a crisis. So I think that we now understand as a wider community, I hope as workplaces and government, just how important care economy is. And so that visibility, that very tangible visibility of what it has meant for parents on a day-to-day basis, where work has very much come into our living rooms, our bedrooms, and our family life in ways we haven't seen before, even though obviously many people did work from home before in various extents, not to obviously the extent we have just done. And it's intruded. And there's been some positive gains from that, where, obviously we have that visibility raised, where we're now aware just how hard it is to do that juggle. And with that brings empathy. I think that's fantastic. But at the same time, there was lots of, oh, look at your situation. Gosh, that looks really hard. Sorry about that. Anyway, moving on, we almost didn't know how to react and what to do, when everyone was sort of, in that moment in their own family units, trying to work out desperately how they were going to make work and family life work. And I think there are lots of situations where it didn't go well in many families, including our own. At one stage, we had my elderly parents living with us as well that were trapped over here. At the time, they live overseas generally. And my goodness, it was pretty stressful. My kids at the time had moved schools, and I suppose I felt such a fraud. I'm supposed to be an expert at balancing work and family, and it just was a disaster. And so I think even for those that were normally used to being flexible with work and so on, this took it to a whole new level. And I don't think we've recovered. I think there will be total PTSD. I think we're seeing the emergence of that. And, we're going to have to think about what that means for our wider society, because it's not an individual problem to solve for. So sorry, a long answer to a big question. Andrea, I'm sure you've got lots to share on this too.
Yeah. I mean, Emma, you mentioned that there is that level of exhaustion and the burnout, which we've also addressed earlier, but what carry-on effects there will be from that, and what sort of long tail will occur there. Andrea, what do you think?
Well, the cohort of families that we support often sit outside mainstream. So they've got children with disabilities, they have somebody in the home who has a compromised immune system, or they live on a remote cattle station. So they're already disadvantaged. So when you look at situations where, it's one size fits all, let's send all children home and assume they've got access to a device and they've got access to high-speed internet, that just doesn't work. And then you've got children with those additional needs where parents are working, and those children need more guidance. They need more support to be doing home learning. So it was really challenging for some of these families. And then, yes, in terms of the care economy, I agree that there was a big highlight of the care economy, particularly the medical profession and teachers. But I think one of the forgotten sectors was early childhood educators, where people just still expected them to go to work. They were the last, to be thought about in terms of priority for vaccinations. And, they still had to turn up to work with a cohort, and still do have to turn up to work with a cohort of people who can't be vaccinated. So they are at higher risk. And again, predominantly female. So they aren't necessarily considered as part of this puzzle of how are we going to get through this and how are we going to recover in terms of caring for them, because they have to care for us. We kind of took them for granted, which is one of the inherent problems with the sector.
Yeah, and we absolutely definitely took them for granted. It is so true. And we often think that when we look at what everyone's experienced about lockdown and things like that, this is a sector that never stopped. They've worked this entire time, and it's not like they can suddenly stop. Maybe they get a week off over Christmas or something, but it's not like they're going to have 3 months back next year or something. They've taken it all on, and taken it all in sense of reacting to emergency measures, implementing health policies and plans, and then reacting to upset and angry families over it. So it's been an exhausting and impossible time for them, and I always want to make sure that we are keeping carers in as part of this conversation.
And the children as well. I mean, I'm part of the Apiary Fellowship, which looks at systemic changes in the early childhood sector, and I'm part of a subcommittee that looks at children's voices, and that's an interesting part of this conversation, is how children have reacted to COVID and changes in dynamics, and how parents and carers and teachers have had to respond to that.
Yeah, I mean, I wonder if you might be able to touch on that, seeing as you have brought it up, because what I see is, I mean, I'm thinking of our own experience with our own school, that the schools our school has closed down a couple of times already, and there is a level of trauma that occurs on those children. I also think too that early childhood education going into next year, when we think 5 to 12s will get their vaccinations, but obviously there's no plan for younger kids, and so we will continue to have those outbreaks across childcare centres. They will shut down. Those children will go into isolation again. And I might say that being in isolation is very different to being in lockdown, and it is quite difficult for children, especially those who are living in small contained places, in apartments, don't have access to outdoor spaces. What have you heard from the voices of children that you mentioned there?
Yeah, we've looked at, so there was a study done by the committee before I joined, where they asked children what did you feel about COVID? And one of the resounding questions was, nobody asked us, or nobody told us what this coronavirus was. And as a parent, I mean, you probably felt the same way. There was a lot of protection. I don't really want to talk to them about it. I hope this passes. I hope we don't have to discuss coronavirus. But that was actually one of the resounding things, was children were like, why didn't anybody talk to us about this? Why didn't anybody ask us how we feel? And to your point about Emma, like your own children coming at you and you work in this sector and you're like, I don't know how to handle this information, but we're still human at the end of the day. And also when it's your own children, you're more empathetic and you feel that a lot more than, say, in a clinical or professional environment. So that was the thing. I think taking children on the experience, we're all in it together. The children are as well. I think we're all thinking as adults, we were all in it together, but the children are there too. They're feeling it every time there's a shutdown, every time there's a return to home learning. And then even for my children actually returning back to school, we had really intense conversations about what that was going to look like. How did they feel? Were they worried that, were there going to be new people in the class? So that was really good to have that sort of debrief before school returned as well.
Yeah. So to think about parents now, and I think when we talk about the health of parents, we are definitely talking about the health of their children as well in the same conversation. But to take what we've just discussed now into 2022, what are some of the things, Emma, I'll go to you first, that like the really good employers, and I know that you know some of these employers because they're part of your family-friendly workplaces accreditation, and we have been exploring that through different conversations with some of the CEOs of those organisations. But what are the really good things that you're seeing that makes an impact to the health of parents and the health of families as well, especially going into 22, considering some of the lingering impacts that we'll have from this period?
Yeah. Well, I think first of all is that we're having the conversation. You mentioned family friendly before. That's something we launched earlier this year, the idea of getting organisations to sign up to standards around, minimum policies and practices they'll put in place to support families, what we call bridge the work and home divide. I think the fact that we can say family friendly and work together is already a step forward, because even those two words together, you've heard me say this before, Angela, it's been quite contentious. It's like, family friendly workplaces, well, isn't that for organisations that are a little bit soft, a little bit nurturing and not really serious about their bottom line? And isn't that just about giving some nice little voucher to someone to make them feel better? Rather than seeing it as a really fundamental part of an organisation's well-being, really, the people's well-being. Because when we talk about family, I know we're addressing parents right now, but we all belong to families, however you define that. And, we have a life outside of work, and, we need to meet and should be able to meet those needs and wants of our outside family. And so organisations that are starting to have that conversation to go, and are not afraid, ashamed, or any of those things, to say, hey, we want to be family friendly, absolutely, because we get it. If you can't bridge that work and family divide well, that's going to have an impact on your well-being, and that impacts us as well. And it's a mutual win-win. So I think organisations that are not embarrassed to have that conversation, or ashamed to use that word when it comes to being a business imperative, it is wonderful. This is not a conversation we could have had even 5 years ago, actually, sadly. And so I do think that is a gift that COVID has given us, in the silver lining, that we can now all say that, families are important when it comes to workplaces and how we accommodate them. The other one is obviously this mainstreaming, obviously, of flexibility. Before, flexibility in many organisations was still something you had to apply for. In many ways, obviously women in particular coming back after parental leave, really having to go into bat for why they could do their job 3 days a week now and not 5, or flexibly, or whatever it might be, really on the back foot with that, really having to show the evidence as to why that's possible, and really having to do a sales job, frankly, on their organisation as to why that should be trialled. Well, that's just removed now. I mean, any organisation that says that there's elements of someone's job that can't be done flexibly in many regards just isn't true. We've seen that. So, that is the gift of smart technology. Many of us can actually turn around today, tomorrow, and do parts of our job. Maybe not all, but parts of our job flexibly. So I think this is really embracing flexibility as not just something that's for a minute minority that might need it in an organisation, but mainstreaming that for everyone, because everyone deserves the ability to connect their work and home life, no matter what their parenting situation is. And obviously flexibility is the key to that.
Okay. Andrea, what do you make of that question when we think about what employers should be offering when it comes to what parents need?
Yeah, I mean, I've been through this myself being a lawyer before I started the business. So I had to ask for flexibility. It was the exception. It was nobody else has done this before. You get to be made to feel quite guilty about it. And I ran a litigation practice. So I had to say, look, if I need to run a matter, I'll have to change my days. You have to concede things, which is fine. But that in itself, but you run a litigation practice, how could you possibly work flexibly or part-time? So I think, as Emma said, COVID's just fast-forwarded all of those hesitations and biases, and now everyone just needs to get on with it. I mean, I've experienced that even with my own staff in terms of challenges with their home learning, balancing children, how are they going to do that and meet the demands of their work, and having to let them work, outside hours on weekends just to make up their hours, or simply just give them extra leave and not have to take any of their annual leave. So there's got to be a lot of flexibility. And like I said, thinking about the fact that we're human, we have families, as Emma said, it's not just ourselves that come to work, it's everything in our life that comes to work. And you have to be realistic as an employer and say, and particularly we find that in caring sectors, that if they're caring for other people, their own needs need to be met first, because they cannot give to others if their own cup is overflowing. So I think that employers really need to think about the whole of person rather than the employee.
Okay. All right. So employers, that's just one part of this piece, right? So I want to look a little bit more broader. I know this topic is very broad because it is what parents need, and I can think of a lot of things that we need, but let's go a little bit broader, and it might go into policy discussions now, particularly as we go into an election campaign, and this is a good opportunity to get so many of these issues heard and make sure that they are on front page news as much as we can. But Emma, what would you like to see if we kind of took this to a policy level discussion? What could really help going into 2022?
Look, well, I think it goes without saying, I think most people think that perhaps our audience, that we need much better universal funding, of course, for childcare and paid parental leave. We're just not where we need to be as a country. And I think most people actually are surprised when certainly I advocate for good paid parental leave in particular, that we are so low down the food chain when it comes to this. And we're one of the second or third least generous countries when it comes to having a well invested in paid parental leave scheme. We've had it for over a decade and it's not moved at all. And there is no agenda for it to be moved as far as we can see. Now that hopefully that might be on the table. There's been lots of agitation for that. And obviously the other thing is, how do we design work and family policy so that they link together? We have paid parental leave over here, and we have domestic and family violence funding and leave over here, and then we've got childcare policy over here, and none of them link. We do not have a national work and family policy framework in Australia, unlike other nations that do. In particular, the Scandinavians have done this well. I mean, they've gone further to legislate, very much so, but at least if we could get a framework that really allows and sets down a national vision for how we want to see ourselves as a family-friendly nation, how we link that. We have so many challenges to solve for young people and the next generation. We heard that before from Andrea. Our children are not okay coming out of COVID. Their future is full of so much uncertainty with climate change alone. How do we make sure that our children have the best chance, the best start that they have in life? We are not invested in that as a nation. but when we look at other countries around the world that, you know, have declining birth rates and real challenges here, their governments have stepped up and said, we want to be a family-friendly nation. There is just no such rhetoric at the moment from government on any of this, and we would really need it desperately. It just simply is not good enough where we are right now.
Yeah, I mean, I just think about how also when we see childcare and spending around childcare go into the pool of this is how we're supporting women, or this is women's workforce participation. We haven't even gotten to the level of the conversation that says that this is actually about families. It's about men as well. It's about getting more men to take parental leave. It's about the quality early childhood education that children need and deserve. So we're not there yet. Let's try and push for that over the next few months. Let's make that front page agenda. Andrea, what do you make of that question in terms of what we need and what we should push for?
I think the only thing I would really add to that, Emma's obviously captured all the main issues, so let's just tick that box. But I think what we really need to add is equal access to education, because what I see is people in vulnerable and disadvantaged situations, people with complex needs, don't get the same access as people in, higher socioeconomic or even middle class areas. So what we fight for, I mean, I'm the president of the Australian Home Childcare Association, and we support children whose needs cannot be met in mainstream services. So what we advocate for is equal access for them to the childcare subsidy, to places, to quality education, to quality educators. So, you know, they should have the same rights as children who can fortunately go to a preschool or a long daycare centre. So that's what we're hoping for. And in terms of children with disabilities and families with disabilities, again, equal access to services so that they can participate in the workforce, they can participate in childcare. Their child, if they need support in a long daycare centre, gets appropriate inclusion support, because at the moment that is underfunded. So it is a big piece of work that has intersectionality, like Emma said. There was a consultation done by the Department of Social Services at the Commonwealth level on vulnerable cohorts and how out-of-home care, NDIS, things like that intersect, with a particular slant on Aboriginal and Torres Strait Islander children as necessary. So that type of work is really important. How do these schemes work together? How do they talk to each other so that children aren't just being sent from pillar to post when their needs aren't being met in a particular location?
Do you feel that we're getting anywhere with that conversation?
Yeah,
There's been a consultation, so do you feel that could change?
Absolutely, yeah. Look, we think that we're getting somewhere with the department at the moment, with some of our advocacy, and really hoping to get some more equality for these children and for these vulnerable cohorts. I'm really hoping that DSS consultation has things that other states and other departments can learn from. So yeah, I think it's on the radar, and I think obviously the universal childcare argument is on the radar for the election. But I think as long as we're talking about it as a larger policy discussion, and it's not just about one minister or one department getting wins on the board, it's about the child at the centre, the family at the centre, and looking at this as a holistic solution.
Okay. All right. So again, we're covering a lot in this session, but I wanted to get to one of our final discussion points, which takes it back to, I guess, the individuals. So those perhaps listening in right now to this session, seeking maybe a bit of advice on how they can access a more family-friendly environment in whatever kind of organisation that is, especially for one that doesn't have these policies or doesn't actually walk the talk on the policies that they have. What do you have any advice for what people can do in an organisation where they don't have those progressive family-friendly policies? How they can speak with the manager about the flexibility they need, how they can look for a little bit of empathy or in terms of their situation or whatever's going on in their family, if that's young kids, if that's caring for someone with a disability, if that's elder care, whatever that is.
Mm-hmm. Okay, from my point of view, and I'm going to kind of wear my HR hat now as well, because that's my background. I think as a business owner, even myself, I just don't know one organisation that isn't looking at transformation right now. I think every single business has had learnings, has had to pivot, build new products, services, whatever, to really redesign their organisation, what they do, how they do it. So there's a really good opportunity while an organisation is redoing that, for you as an individual to really start those conversations around redesigning jobs for you as well in that. Because really a lot of what we're talking about here is job structure, design, and really thinking about how we can show up and do the best job that we can do. So as your organizations are very much most likely redesigning things, now is a good time to say, hey, can I have a chat about how we might be able to redesign my job? So that's just at a really sort of pragmatic, practical level, because sometimes trying to tackle what I call the social agenda in your organization, trying to be that one lone voice about, hey, why don't we introduce family-friendly workplace practices? And that looks like X, can feel hard, and you're trying to fight the system and vulnerable in that moment. So I think a really practical, pragmatic way to attack this is really to think about, if I could design my job differently in 2022 that would help me bridge my work and family divide, what would that be? How would I restructure that job, and how could I take that conversation to my leader as a start point? And of course, if you think that there's an agenda open, if your organisation is really looking at this and is exploring 4-day working weeks, or really is really turned around on this, but is lacking some ideas on how to do it, definitely check out the Family Friendly Workplaces page, because we've got so many case studies of what all sorts of organisations are doing.
Yes, absolutely.
The only thing I would add to that is just two practical things. One is to have courage. So it's not easy to be the first person to go and ask for something, especially in corporates, large entities where they've never done anything before like that. So courage is absolutely key. And then the other thing is potentially finding a sponsor or an advocate to help you along the way. So somebody who's in the same boat, or somebody who could empathise and could potentially take it to a leader if you're not confident taking it yourself.
Okay. And then what about leaving?
Leaving because
not everybody
won't change, or leaving.
Well, that's the thing. The organisation won't change, but for your personal circumstances, what about leaving, resigning?
I think sometimes that is the best solution for mental health. Like sometimes people are in a situation where the workplace isn't the right place for them from a mental health perspective, and they do have to they have to make the decision that's right for them and their family.
Yes, absolutely. Yeah. All right, Emma and Andrea, thank you so much for joining me. The next session is about some of those leaders, so it takes a different point of view, which will be nice to see. So I believe there are also 2 organisations who are family-friendly workplaces accredited as well. So good. That is excellent. So excellent. I'm going to bring them in right now, and we will hear their perspective and how some of the best practice examples they've been using. So thank you so much for joining me.
Thanks, Angela.
Thanks for having us.